The basal ganglia are two large groups of nerve cells located near the base of the brain, which consist of the caudate, putamen, and globus pallidus. Together, the caudate and putamen form the corpus striatum, or striatum. The substantia nigra is a tiny structure located deep within the brain. There are actually two structures, but they are typically referred to as a single entity in the medical literature. Normal movement depends on adequate levels of the neurotransmitter dopamine, produced by cells in the darkly pigmented zona compacta of the substantia nigra, and delivered to the striatum and other parts of the brain. Because this motor pathway involves the substantia nigra and the striatum, it is known as the nigrostriatal pathway. The synthesis of dopamine begins with the amino acid tyrosine. Within the neurons of the substantia nigra, tyrosine is converted into levodopa through the action of the enzyme tyrosine hydroxylase. Levodopa is converted into dopamine through the action of the enzyme dopa decarboxylase. When signaled by an impulse traveling down the axon to the synapse, dopamine is released into the synaptic cleft. Some of the released dopamine binds to dopamine receptors on the receiving neuron, triggering a signal that is relayed through neurons to the motor center in the cerebral cortex of the brain. This signal eventually travels through the spinal cord to modify activity in muscle cells. Within the striatum, there is a delicate balance between dopamine and acetylcholine, another important neurotransmitter. In patients with Parkinson's disease, there is massive degeneration of dopamine-producing cells in the substantia nigra. The dopamine supply to the striatum is gradually reduced. This disrupts the balance between dopamine and acetylcholine, resulting in a relative excess of acetylcholine. When 60% to 80% of dopamine-producing cells in the substantia nigra are damaged, the extrapyramidal system loses the ability to effectively promote movement, and the motor symptoms of Parkinson's disease, such as resting tremor, rigidity, bradykinesia, and postural instability, begin to appear. Therefore, a primary objective of pharmacologic therapy of Parkinson's disease is to increase dopamine levels in the brain.
In Parkinson's disease, nigrostriatal dopaminergic neurons are not able to produce enough dopamine, which stops the neurons in the corpus striatum from exerting their control on movement pathways, leading to the characteristic tremor and jerky movements associated with Parkinson's disease. One way to counteract this is to give the patient levodopa, the precursor to dopamine. Let's see what happens if we administer levodopa. In the end, only 5 to 10% of administered levodopa actually manages to cross the blood-brain barrier. It is then taken up into nigrostriatal dopaminergic neurons, where it is metabolized by dopa decarboxylase into dopamine. The end result is less dopamine available to be transported to the dopamine receptor on neurons in the corpus striatum. However, there are ways we can get around this. Carbidopa and benzericide are dopa decarboxylase inhibitors. They block the actions of peripheral dopa decarboxylase, stopping it from breaking down levodopa into dopamine. COMT inhibitors, such as entacapone, block peripheral COMT. Blocking the actions of these two peripheral enzymes results in more levodopa crossing the blood-brain barrier to be taken up by nigrostriatal dopaminergic neurons, where it is metabolized by centrally acting dopa decarboxylase to produce dopamine. To prevent this dopamine being broken down by MAOB, an MAOB inhibitor such as selegiline can be used. And to prevent dopamine being broken down by centrally acting COMT, a COMT inhibitor such as tolcapone can be administered. The overall effect of these medications is to increase the amount of dopamine available to be transported to the dopamine receptors on the neurons in the corpus striatum, increasing its influence on movement pathways and reducing the movement problems associated with Parkinson's disease.
to just get antibodies against these aggregated proteins in neurodegeneration as treatments, as causative treatment for neurodegenerative disorders. And after a long time and period of negative trials, there has been now a positive one in Alzheimer's disease, in very early patients with Alzheimer's disease. And this is really exciting because I think this will also move the Parkinson's disease forward. And this, of course, is exciting when you can help trials going forward with that. And the second thing is that we just got approval of another Horizon 2020 grant, which is a project. It's called Pro-Park Aging, where we're going to compare the DENOPA patients with Parkinson's disease with an existing cohort of centenarians. So we shift towards the comparison of healthy aging and find biomarkers for healthy aging to support healthy aging. And this is also very exciting, I think.
So the highlights in Parkinson are, again, how does Parkinson progress? Now we have a new theory of the prion mechanism of Parkinson's disease, and it's an important question of whether this is correct or not. If it is correct, whether having antibodies against alpha-synuclein is going to prevent or slow down at least the progression of the disease is another debate that we're going to have. The question of what do you do to the cognitive dysfunction and to the mental changes that occur in Parkinson's disease. In some cases this is very early, we call it MCI, mild cognitive impairment in Parkinson's disease. Is this a valuable concept or not? Does it help? And who does it help? Does it help the clinician or does it help the patient to make this diagnosis? What are the new imaging methods that we have to try to evaluate not only the diagnosis but also the progression of the disease, and some are being developed now to try to have imaging of the synuclein deposits in the brain.
The goal of my work is to be able to study Parkinson's disease patients on and off medication, and the idea behind that is to be able to see if there is a biomarker for this disease and to see how the medications are impacting the brain. And so if there is a way to diagnose this disease using these brain stimulation modalities, we would have a better picture of treating it earlier, and something known as the prodromal Parkinson's disease phase would be identified earlier and would lead to better treatments of the disease and perhaps better life expectancies, and would lead to a lot of better outcomes when we have diagnosed it earlier.